Hi everyone, welcome back to my channel. In today's video, we'll see some important compliance and regulatory questions. These questions are very important for your CPC exam practice. Make sure you take notes while answering these questions. Let's start with the first question. Before that, don't forget to hit the like button, share this video and subscribe to my channel. Which federal regulation protects the privacy and security of patient health information? Option A, HIPAA, option B, high-tech, option C, EMTALA, option D, CMS. The right answer is option A, HIPAA. Health Insurance Portability and Accountability Act. It protects the privacy and security of the patient health information. Option B, high-tech. That is Health Information Technology for Economic and Clinical Health Act enhances HIPAA enforcement but does not directly cover privacy and security on its own. And option C, EMTALA, that is Emergency Medical Treatment and Labor Act. It ensures emergency medical care but does not regulate health information privacy. And option D, CMS, Centers for Medicare and Medicaid Services. It oversees healthcare programs but does not specifically regulate patient privacy. So for this question, the right answer is option A. Next question. Upcoding is considered a violation of which compliance regulation? Option A, False Claims Act. Option B, Anti-Kickback Statute. Option C, Stark Law. And option D, OSHA. Can you think of the right answer? The right answer is option A, False Claims Act. Next question. A healthcare provider offers free services to patients in exchange for referrals. This practice violates which regulation? Option A, Anti-Kickback Statute. Option B, Stark Law. Option C, HIPAA. Option D, EMTALA. The correct answer is option A, Anti-Kickback Statute provides offering or receiving anything of value to induce referrals for services payable by federal healthcare programs. Next question. What is the role of Office of Inspector General in healthcare compliance? Option A, to investigate and combat fraud, waste and abuse in healthcare programs. Option B, to regulate medical coding guidelines. Option C, to develop ICD-10 CM codes. Option D, to enforce HIPAA privacy rules. The correct answer will be option A. The OIG, that is Office of Inspector General, investigates fraud, waste and abuse in healthcare. Option B, medical coding guidelines are regulated by AMA and CMS. And option C, ICD-10-CM codes are developed by the WHO. And option D, HIPAA privacy rules are enforced by the OCR, not OIG. I hope you're clear with it. Next question. Which of the following is an example of Medicare fraud? Option A, billing for services not provided. Option B, unintentional coding error. Option C, failing to obtain prior authorization. Option D, undercoding a procedure. The correct answer is option A, billing for services not provided. It is considered a Medicare fraud. Option B, unintentional coding errors are mistakes. It is not fraud. And option C, failing to obtain prior authorization may result in claim denial but does not qualify as fraud. And option D, undercoding is more closely linked to documentation errors or abuse. Next question. Which legislation provides financial incentives for healthcare providers to adopt and demonstrate meaningful use of EHR? That is Electronic Health Record. Option A, HIPAA. Option B, High-Tech Act. Option C, Stark Law. Option D, Anti-Kickback Statute. The correct answer is option B, High-Tech. It promotes the adoption and meaningful use of electronic health records through financial incentives. Option A, HIPAA, is incorrect because HIPAA focuses on protecting health information, not promoting EHR adoption. Option C, Stark Law, is incorrect because it addresses physician self-referrals, not EHR incentives. And option D, Anti-kickback statute, is wrong because it prohibits offering or receiving payment for patient referrals unrelated to EHR adoption. Next question, what type of information is not maintained in a medical record? Option A, financial records. Option B, treatment outcomes. Option C, observations. Option D, medical or surgical interventions. The correct answer is option A, financial records. Financial records are not maintained in a medical record. Medical records typically include treatment outcomes, observation, medical or surgical interventions. But financial information such as billing or payment details is usually kept in a separate financial or billing record. It is not maintained in a medical record.